What they don't tell you about masturbation. In men over 50, could this habit be beneficial or harmful to their sexual health? Hello everyone, I'm Samira Pose, a urologist, who treats both male and female patients. Today, we'll discuss sexual health and the health of the genitourinary tract. But let's get to today's topic. What is the effect of masturbation on the sexual lives of men over 50? During the COVID-19 pandemic, social isolation measures and changes in daily routines significantly altered the sexual habits of the population. This affected both younger and older adults, but it was particularly impactful for those who isolated themselves more from society, especially the 50-plus age group. In this context, some habits became part of their routines, such as increased consumption of pornography and masturbation. Currently, there is limited literature on the effects of masturbation and pornography consumption in this older population. It's known that patients over 50 or 60 experience physiological changes in their bodies, such as a decline in testosterone production and cardiovascular health issues. These patients are at risk for conditions like hypogonadism, andropause, and erectile dysfunction. The fact is that masturbation, whether associated with pornography or not, can worsen erectile dysfunction, ejaculation disorders such as premature or delayed ejaculation, and even anorgasmia, the inability to reach orgasm. It can also drastically alter libido and sexual desire. Masturbation conditions the male brain to achieve pleasure and orgasm through self-stimulation, but these stimuli are not replicable during real sexual intercourse with a partner. The pressure, intensity, and frequency of self-stimulation are completely different from those experienced during actual sex. The same logic applies to pornography consumption. We know that the porn industry is fake and unrealistic. The visual and sensory stimuli it provides cannot be reproduced in real sexual relationships with a partner. As a result, low libido, hypoactive sexual desire, erectile dysfunction, and ejaculation disorders can be exacerbated in men who consume a lot of pornographic content. Of course, these negative impacts depend on the social context in which the man lives, his overall health, and the frequency and manner in which he practices these habits. For example, when masturbation or pornography becomes an uncontrollable compulsion, interfering with interpersonal relationships, personal routines, or work, it can be considered a disorder. This patient needs medical help, as it can be a risk factor for emotional disorders, chronic stress, anxiety, and even depression. Regarding masturbation, it's necessary to debunk some myths, such as the idea that frequent masturbation and ejaculation can reduce the risk of prostate cancer. There's a lot of talk about the association between increased ejaculation frequency and prostate cancer prevention, but the truth is that there is no strong scientific evidence or clinical trials proving this link. Therefore, masturbation is not a proven protective factor against prostate cancer. Additionally, it's a myth that masturbation can increase libido in men or couples. On the contrary, excessive masturbation can lead to desensitization to natural stimuli, causing many men to lose interest in real physical relationships with their partners. If this is affecting your sexual life or marriage, seek medical help, as there are solutions. Another important point is the issue of penile disuse. Many patients are concerned about having a hypoactive sexual life and turn to masturbation and pornography as a substitute. A more appropriate treatment for these patients could include pelvic floor physiotherapy, vacuum therapy, and Kegel exercises, which strengthen the pelvic muscles and improve blood flow, thereby enhancing pelvic health. Masturbation should not be considered a solution for penile disuse or atrophy, especially in the at-risk population of men over 50, as it can be associated with hypoactive sexual desire, low libido, erectile dysfunction, or worse, unning of existing conditions, as well as ejaculation disorders like premature ejaculation or anorgasmia. If you found this video interesting and think it could help someone you know, share this information so YouTube understands that this content is valuable and recommends it to more people. Don't forget to subscribe to the channel to follow our weekly content. Take care and see you in the next video.